Here with Mark Simmonds, Shadow Minister for Health. Mark, could you give us a feeling for what the main priorities an incoming Conservative government might be?
Well, we would like to transform the health service in three distinct ways. The first is we want to make the National Health Service much more centred around the patient than it currently is. The second thing we'd like to do is to make sure that the National Health Service is based and focused on delivering better patient outcomes, not centrally driven process targets. And the third area is we want to have a much greater emphasis on prevention and public health than has been the case in the past.
And just on prevention, on that last point, can you give us some more detail on how you're going to deliver that? It's been a difficult one for governments to deliver over the years.
Yes, well, the first thing we're going to do is to allow GPs to commission to purchase services on behalf of their patients, which will include some services that relate to public health. We're also going to ring-fence public health budgets to mean that those commissioners and trusts can't manoeuvre those budgets around to shore up deficits or use them on other services. We're also going to change the name of the Department of Health to the Department of Public Health. We'll have a Secretary of State for Public Health. And we're also going to enhance the Chief Medical Officer's role to give him or her a much bigger cross-cutting role in government, because public health is not just about policies coming from the health department, but also about housing, environment, occupational health, etc. And we think that putting those in one hands will make the delivery of those policies much more effective.
Can you tell us a little bit about the role that the pharmaceutical industry might play within that?
Well, we think the pharmaceutical industry is a significant contributor to the UK economy, both in terms of paying revenues to the exchequer, but also in terms of employment. And we want to make sure that the pharmaceutical industries that are here in the UK stay in the UK, but we also want to make the UK a more attractive place for pharma to be based, to invest both in research and development and manufacturing. So we're working through the detailed policies of that at the moment as to how we can achieve that. But the biggest priority that we'll have is to try and put the macroeconomic situation back into a form of stability, and that will have to be done by primarily putting the public finances back in a sensible and structured way.
Implications for the PPRS, and you also mentioned values-based pricing. Can we just talk about that a little bit more?
Yeah, we're going to leave the PPRS in place until it expires in 2014, and during that period we will be consulting with the pharmaceutical industry, and that consultation has already started, about moving for new products to a value-based pricing mechanism, which will reward pharmaceutical companies for the actual therapeutic value of those particular drugs that they research and develop. We're not going to get rid of NICE. We think NICE does a good job. We think it's important to have an independent body that analyses and looks at the efficacy and the cost effectiveness of drugs. But we do think that that could be speeded up, and we also think there needs to be much closer cooperation between NICE, the pharmaceutical industry and the Department of Health to make sure that these drugs and products get to the patient faster than they're doing at the moment.
And finally, can you tell us a little bit more about how you plan to focus on prevention and improving patient outcomes?
One of the big issues in the health service at the moment is that we think it looks upwards to Whitehall, not outwards to the patient. So we have to find mechanisms to get the whole of the health service to focus on patient outcomes. That means making people better, and the funding should follow those patient outcomes. So GPs, for example, will be rewarded through the quality and outcomes framework for making patients better, not just the processes that they go through. The tariffs going to hospitals will be based much more on patients, making patients better, patient outcomes, rather than just the level of activity as happens at the moment. And we think those mechanisms of transferring the funding to revolve around patient outcomes rather than levels of activity will go some way to improving patient outcomes.
And one last question, could you just tell us what we might anticipate over the next 6 months in the run-up to an election from a health perspective?
Well, I think health is going to be one of the big dividing lines at the next election. I think our policy of any willing provider, i.e. involving the independent sector in the provision of healthcare, as long as it benefits patients, is a very big dividing line. We think the government are putting political ideology in front of patient care. We've also said that we're going to ring-fence the National Health Service budget. We're also going to invest on it in the National Health Service in real terms during the course of the next Parliament, which is in stark contrast to the Labour Party's policy of finding £15 to £20 billion worth of cuts from the health service. That doesn't mean we can't use the resources more effectively and efficiently than they're currently doing so.
Mark Simmonds, Shadow Minister of Health, thank you very much indeed for your help.